In this episode, Sue Ellen Anderson-Haynes dives into the effects of preconception diabetes on getting pregnant and on pregnancy overall. She explores the connections between preconception diabetes and gestational diabetes, as well as the potential impacts on breast milk. Tune in to learn more about how you can utilize a holistic approach to wellness and nutrition therapy to support your health and that of your baby. Podcasting from Dallas, Texas, I am Shireen, and this is the Yumlish Podcast. Yumlish is working to empower you to take charge of your health through diet and exercise and reduce the risk of chronic conditions like type 2 diabetes and heart disease. We hope to share a unique perspective and a culturally relevant approach to managing these chronic conditions with you each week. Sue Ellen is a mom, health writer, and speaker, recipe developer, co author, wellness educator, and women's advocate with over 15 years of training in the health, wellness, and dietetics field. Welcome, Sue Ellen.
Thank you for having me on line today. I appreciate it.
Absolutely, an absolute pleasure having you on. So, Ellen, I want to dive right in and ask you, how did you become interested in nutritional therapy and diabetes education, especially for pregnant women?
Yeah, so I became interested in diabetes during my dietetic internship at Florida Hospital. As an intern, I was impressed by the dietitian I worked with and the way that she was able to lower her patients' blood sugar and thus the risk of chronic disease by specific strategies, namely medical nutrition therapy. And also by teaching diabetes self management skills. Additionally, in the inpatient setting, which is a hospital, I was able to observe and help manage symptoms of pregnant women who had hyperemesis or uncontrolled nausea and vomiting and blood sugar issues and other medical issues. So I saw both sides of the outpatient and the inpatient setting. And my fascination grew. My fascination for women's health became more intense when I became pregnant with my daughter. I became more hyper vigilant in everything as it pertains to like health and wellness, mother and baby. So that's kind of where my interest sparked.
Interesting. So, help us understand, how does type 1 diabetes preconception affect women's pregnancies?
Yeah, so preconception education and treatment can prevent complications for both mother and baby. And I'll talk a little bit about some of those complications. But type 1 diabetes basically means you don't have insulin. You're not producing enough insulin. And so insulin helps to lower your blood sugar after eating a meal, particularly a meal in carbohydrates. So without insulin, someone with type 1 cannot survive. Most women with type 1, because of this pregnancy, or when they're planning pregnancy in the pre-pregnancy stages, they need devices to help them better manage these narrow blood glucose ranges, such as a continuous glucose monitor or insulin pump. And so, working with a registered dietitian and the rest of the team, we help bring these ranges in better control, and so lowering their risk of these complications. And I'll tell you a little story. Well, two stories, very short stories. So one patient that I worked with struggled with team recommendations and the diabetes self-management skills that we were showing them. They kind of struggled to maintain those skills and to just to follow up accordingly. And sadly, they had preterm birth, meaning that they delivered before 37 weeks. And one of the reasons were due to the uncontrolled blood sugars, in addition to other complications that she was having. So, on the flip side of this, though, are other patients that I work with who do really well with following through with their self management skills and the nutrition and therapy that we provide. And they have good support at home. And they eventually have a healthy pregnancy and a healthy baby. And now this is with diabetes. So it is possible to maintain the recommendation and to seek out help before pregnancy and during pregnancy.
Interesting. And both of these are type 1? diabetes?
Yep, or type 1 patients that have been pregnant, correct.
So let's switch gears to type 2 diabetes. How are the effects similar or different?
Yeah, so pregnant women who have type 1 and type 2 diabetes, like I was saying earlier, what's similar? Let's start there. So the complications are similar. You can have congenital malformations for the fetus, which means that they could be born with heart problems or any kind of congenital issues can occur for the fetus. And for the mom, there are other issues that can occur for mother as well. Their hypertension can get really out of control. Their eyes could be affected, their kidneys. There's a lot of different organs that can be affected. Blood sugars are not well controlled for type 1 or for type 2. So again, what's similar? The complications are similar for baby and mother. The difference for type 2 is that most women with type 2 diabetes have more insulin resistance because women with type 2 diabetes tend to be more obese than those with type 1. According to research and according to actual practice, we see that people with type 1 tend to be more overweight, including women. So it may be more difficult to manage blood sugars because of this strong insulin resistant factor with type 2. People with type 2 can still produce some insulin, but initially may need to go on oral medication or pills. And diabetes over time can become progressive, meaning that you may need insulin if it's not well controlled. However, because 1 in 4 people with diabetes don't know they have diabetes by the time they actually get diagnosed, the progression gets so rapid and you may have to be put on insulin right away. So what does this mean for pregnant women? Well, if you don't know you have diabetes and you get pregnant, it puts you at risk for serious complications. And so, like another story would be like a patient that came to the clinic early in the pregnancy. She was about at the 7 or 8 weeks. She came to our clinic early on, and she wanted diabetes prenatal pregnancy care. However, her blood sugars were uncontrolled. She did know that she had diabetes versus other individuals that didn't know, but she did know, but they were not well monitored. She wasn't following up with her diabetes over time, and she found out now she's pregnant. And within, I saw her, we had a clinic visit, and she seemed like she was going to follow through. And within a short few days or maybe a week, she called the clinic that she had a miscarriage. So that is complication similar to type 1 and 2 with uncontrolled blood sugars. You could have miscarriages or early abortion basically of the child. So that's an example of things that are similar and things that are a little different with type 2. But again, the complications are the same, similar.
Mhm, mhm. It's amazing the impact that it can have, and yet we have, like you said, 1 in 4. Even if it's undiagnosed, a person may not even know what is going on with them,
Yeah.
right?
And
Um,
oftentimes we'll have women, they don't know they're pregnant and they don't know they have diabetes. And they end up in the ER and they're like, well, do you know you're pregnant? And do you know you have diabetes? Your
mhm,
A1C is like 10. And they're like, what? So, yeah, 1 in 4, they don't know they have diabetes. And most of
mhm.
the diabetes in the United States is about 90% of it is type 2.
What else do you think women with pre-diabetes or even diabetes preconception should know even before pregnancy?
So, what I think that women with diabetes should know, even before pregnancy is that you can increase your chance of having a healthy pregnancy because the people sometimes think that diabetes is a death sentence. It is not a death sentence. You can live very healthy with diabetes, dependent on you. It is a self-management disease. So, we give you the tools and you have to manage it with proper guidance, right? So self-management. So the key message would be that you can increase your chance so much of a healthy pregnancy if you get prenatal care early. Get it as early as possible. As soon as you have the thought of becoming pregnant, go to your team, which is your registered dietitian, which is your OB GYN, your endocrinologist. Go to your team so that you can get proper counseling and we could set you up for a healthy pregnancy. The more planning you do, the better the outcome will be.
Are type 1 and type 2 diabetes linked in any way to gestational diabetes? And if so, how?
Yeah, so type 1 is not linked to gestational diabetes. Type 2 is linked to gestational diabetes. So When you have gestational diabetes, about 50% of women go on to develop type 2 diabetes in about seven to 10 years or so. And these numbers are even higher for women of color. And it's alarming. And many people don't know that, if you have gestational diabetes, you read also that, oh yeah, it goes away after you deliver. Yes, it can go away, but sometimes it won't go away. I've seen it for women that, I was told in class that, or I've read somewhere that it's going to go away. And like, well, there are some small exceptions, and sometimes it doesn't go away depending on how intense your gestational diabetes was during the pregnancy, right? Because when you take the oral glucose tolerance test, your numbers could be so high that, it's concerning that this may turn into type 2 later on, very sooner than those that are just missed the mark. Because there's a glucose test that you take in the pregnancy at 24 to 28 weeks for gestational diabetes. And if you fail this glucose tolerance test, you're then diagnosed with gestational diabetes. And what puts you at risk for gestational diabetes are a few things. And one of them is pre existing PCOS, or polycystic ovarian syndrome. Another could be you have, history of overweight or obesity. And another, surprising to many, is a cultural background that is a risk for having gestational diabetes. And what I mean by that is that if you are of African American descent, Hispanic, Asian, Native American, your risks are higher for having gestational diabetes. And just to kind of explain what gestational diabetes is, it's different than type 1 and type 2 because this happens at during the 24 to 28 weeks when the hormones produced by the placenta kind of counteract the mother's ability to produce insulin efficiently. So there is insulin resistance, right? The placental hormone makes it hard for the woman again to compensate for the amount of insulin they need. And so it's difficult for mothers to keep their blood sugars in a normal range after eating a meal. Some women with gestational diabetes do need insulin in their pregnancy. Some do not. Some we help to manage with just nutrition. We call it a diet and lifestyle and activity, and they are fine. And usually, those women that are able to maintain in the pregnancy with this lifestyle approaches tend to possibly have gestational type 2 diabetes later on in life. Those women that usually take insulin, the women that usually take insulin during their gestational diabetes phase, we in practice, I haven't seen much studies, but in practice, I've seen that they later on get type 2 diabetes even sooner, especially if they don't go back to their pre pregnancy weight within 6 months to a year, if they're not breastfeeding. I think we'll talk about that later. But gestational diabetes is very serious. It puts you at risk for type 2, and which is the most prominent type of diabetes in the United States and across the world.
So, how can women with type 1, with type 2 diabetes utilize food and nutritional therapy before conception and during pregnancy to support their health and that of their child?
That's a good question. So, kind of like a loaded question in essence, but so a combination of medical nutrition therapy and diabetes self management education given by a registered dietitian may include, but it's not limited to, education on foods can help produce a slower rise in blood sugars. There are strategies like shopping, how to shop for foods, what to look for, reading labels, ingredient lists, meal planning, activity. A lot of these strategies are all individualized. So when you say, how can women utilize these services, they need to actually go to the professional so we could show you how to support your diabetes and pregnancy journey. So seeking out a registered dietitian who specializes in diabetes and pregnancy is extremely important. That is a first step. You want to make sure you're doing that along with the rest of the pregnancy team. But nutrition therapy plays a vital role because, like I said before, in terms of gestational diabetes, you can manage gestational diabetes simply with just lifestyle, nutrition, therapy, and activity. Whereas type 1 and 2, if they do, most type 1 need medication, well, all type 1, they're on insulin, excuse me, need medication management. But without nutrition, it's kind of like running through you're on a wild goose chase, I would say, without nutrition, because that's part of the puzzle. They all fit together. And with type 2, some women may be on oral medication, or we may have to switch them over to insulin, because research doesn't really support taking particular oral medications during pregnancy, even though some providers do give that. So when you look at it either way, nutrition therapy benefits type 1, type 2 gestational diabetes, and it lowers your risk of complications for mother and baby. And research does support that heavily. So, again, the best way to utilize this is seek out a registered dietitian in their pregnancy team or prenatal team.
So, help me understand, does type 1 or type 2 diabetes influence breast milk? And if so, how?
Yeah, this is a really good question too, and it's not given notice. And some studies do show that breast milk production may lower, or like it may delay women who have diabetes, delay their breast milk production. And so why? Because when blood sugars are uncontrolled, blood flow is compromised, right? And similar, if you think about with healing, if someone with diabetes have a wound or a cut, we always say that you are at risk for poor wound healing because circulation is not adequate. The red blood cells are occupied with sugar molecules, and they're not able to move freely through our blood, through our vessels. And so if you think about breast milk production, blood flow is an important part of breast milk production. And so I've read some articles and some studies that show that it's slower when breast milk comes out, slower for those women that have diabetes and for those whose diabetes are not well controlled. So it can be, a little depressing if you're trying to breastfeed and you're like, I can't get enough milk because possibly blood sugars are not where they need to be. But once they continue to breastfeed, lactation consultants do show that breast milk supply does continue to flow and flow more quickly. So again, it doesn't flow as quickly. It's much slower than those women that don't have diabetes, but it doesn't mean that they won't produce any breast milk. So it does mean that you really want to key in on having a lactation consultant. You want to make sure you have nutrition support from a dietitian to help you with your meals and planning, because without adequate intake, meals, fluid, and all that, your breast milk production can be reduced. So technique, along with nutrition, along with support from family members and friends, will continue to help women with diabetes breastfeed more efficiently. Because another study shows that women with gestational diabetes, if they continue to breastfeed, and this is awesome, if they continue to breastfeed, their chance for getting type 2 later in life decreases. And this is just gestational diabetes, right? So diabetes overall, breast milk production is slower. But like I said, the good thing is that if you continue to breastfeed for women with gestational diabetes, your risk for getting type 2 is lower. And overall, any woman, whether diabetes or not, there are benefits for breastfeeding for the mom and for the baby. Helps to shrink the uterus, helps with the good hormonal feelings, sensation that the woman gets from breastfeeding. And also it helps with the baby with lung production, decreases risk of developing asthma and different types of health issues, and the good microbes that the baby needs for gut production and immune system is there. So we really encourage breastfeeding in the clinic. In my practice, we encourage it, and we try to give support for those who may want to stop breastfeeding sooner. Totally up to them. There's some contraindications, medications that you may not be able to breastfeed with those medications, but for those who can breastfeed, we support it 100%.
What is the importance of a holistic approach to wellness and adaptability to your body's needs as they change throughout your life cycle and pregnancy, especially when you have a chronic condition like diabetes?
Addressing life cycle needs using a holistic approach is something that 360 Girls and Women specializes in. And it is extremely important that you look at the whole person and meet them where they are in terms of their health goals and their life cycle needs. So the wellness recommendations that I may give to a teenager, for example, or a young adult is totally different from an older woman. And now if you're pregnant and you have diabetes, meal recommendations and supplementation is different. So life cycle again, approach is different. You can't give the same recommendations to everyone. And studies show that people with diabetes, for example, have low magnesium, right? So if I were not keen to this, I would kind of ignore this in the assessment, but I make sure that I'm addressing their magnesium needs, looking at their diet, asking specific questions. And this is just one particular example of nutrients that I zone into when doing a nutrition assessment with someone that has diabetes, with a woman that has diabetes. And their blood sugar goals, again, are different, and they have ranges that their blood sugar should be in. Whereas a woman who does not have diabetes, that is not more of a concern for us. So, holistic approach, meaning, whole body, addressing their mental health, asking for support if they need it, making sure that, they're also active, and going over those types of techniques with them. If they need to, referring them to an exercise physiologist if need be, or, providing other recommendations. But definitely just not focusing on one part of a particular person. You may miss out on answers if you're just focusing on just one particular part. And patients, sometimes they give you clues as to, other things that are affecting them that are challenging. And it is up to us as a provider to make sure that we are listening to what they're telling us, and also listening to what they're not telling us, so that we can make the proper referrals, recommendations, and treatment plans.
In the last minute we have here, what if you had to give one tip related to nutrition therapy for women looking to incorporate nutrition therapy through their gestational diabetes? What is a one tip that you would give them?
I would say that make sure that you are not skipping meals, not skipping out on carbohydrates. We see women with gestational diabetes, also type 1 and type 2 diabetes, they avoid carbohydrates. They think that carbs are the enemy, but you actually need carbs. They're the main fuel for your brain and red blood cells, and the main fuel for the fetus's brain and red blood cells. So whatever you do, don't eliminate your carbs. It's all about managing and choosing the right portions for you during your pregnancy.
Love that. And with us, Sue Ellen, we're toward the end of the episode, unfortunately. How can our listeners connect with you and learn more about your work?
Yeah, they could connect with me on my website, 360girlsandwomen.com. They can also follow on IG and Facebook. My handles are at 360girlsandwomen.com. And we use nutrition as a foundation, along with other innovative practices, to help women journey to complete health with a complete life cycle. So if you need more information, feel free to reach out.
Will do. And we'll link all of this in the show notes. Thank you so much, Sue Ellen, for your time today. This was very informational. Thank you for your time.
Yes, thank you.
And to our listeners out there, head over to our social media on Facebook and tell us, what's a pregnancy hack you think other women should know? Head over to our social media, find our Facebook post on this podcast, and comment on it. We will see you there next. Thank you for listening to the Yumlish Podcast. Make sure to follow us on social media at Yumlish _ on Instagram and Twitter, and at Yumlish on Facebook and LinkedIn for tips about managing your diabetes and other chronic conditions, and to chat and connect with us about your journey and perspective. You can also visit our website, yumlish.com, for more recipes, advice, and to get involved with all of the exciting opportunities Yumlish has to offer. If you like this week's show, make sure to subscribe so you can hear more from us every time we post. Thank you again, and we'll see you next time. Remember, your health always comes first. Stay well. We have an exciting announcement. Starting next week, we will be dedicating our episodes to National Childhood Obesity Month for the entire month of September. We hope to increase awareness around childhood obesity and connect you with experts to help you better prevent childhood obesity and support related initiatives.